Did you know that Ayurveda describes 11 different types of headaches that are rooted in dosha imbalance, impaired digestion or ama formation, stress, and obstruction of prana in the head and neck channels? Whether it is a throbbing pressure, a burning migraine behind the eyes, or that morning sinus heaviness, your headache is speaking a language. Hello all, Dr. Neha Garg here, an internal medicine physician and an Ayurvedic health counselor. Today we will decode the Vata, Pitta, Kapha and cluster type of headaches, why they happen, their solutions, and some functional medicine correlates. If headaches have been running your life, then this video may finally give you the clarity you have been searching for. So let's begin. Vata headaches are variable and cause migrating pain that is often throbbing or pulsating. Typical triggers include travel, loud noises, cold wind, dehydration, fasting or skipping meals, excess screen time and overstimulation, insomnia, irregular sleep patterns, and excessive worry. Functional medicine parallels to this would be headaches from autonomic dysregulation and adrenal fatigue patterns and cervical muscle tension, or the tension type headache with nervous system running too fast and too dry. Dealing with the Vata headaches is easy. What you need is regular and warm meals, good hydration and electrolyte repletion, magnesium and omega-3 rich foods like pumpkin seeds, chia seeds, flax seeds, and walnuts. Breath work with long exhalation as in Brahmari Pranayama. There is a yogic miracle medicine for Vata headaches which was recommended by Swami Yogananda. It is a simple 3-ingredient spice mix with 1 tablespoon ajwain or carom seeds, 1 tablespoon cumin seeds, and 1 tablespoon fennel seeds. You dry roast this mixture on medium heat till you can smell the volatile oils. Do not overcook. Remove from the flame and grind it into a powder. Take 1 teaspoon of this powder daily in the morning or at night with a glass of warm water. Take this for 7 days and see the difference in the frequency and severity of your tension headaches. Next is Pitta headaches, which are hot, burning, sharp, and intense, and often associated with light sensitivity. They are mostly located in the forehead, behind the eyes, or top of the head. Typical triggers would include excessive sun exposure or overheating, excessive heat in the gut that moves upward and may present as heartburn initially, excessive use of alcohol, fermented foods, spicy foods, sauces, feelings of anger, irritability, overt competitiveness, and inflammation related to food, allergens, medicines, etc. Functional medicine parallels to this would be migraine with photophobia, estrogen fluctuations, and histamine intolerance. Migraines are a classic Pitta disorder with the component of Vata. Heat rises upwards from the gut and liver, causing excessive production of nitric oxide that has an irritant effect on the blood vessels and channels of the head. Migraines are typically one-sided with nausea, vomiting, and sensitivity to both light as well as sound. Helpful interventions for Pitta and migraine headaches include magnesium glycinate once a day in a dose of 400 to 600 milligrams for prevention. This is best taken at bedtime because it also helps with sleep. Omega-3 supplements or foods like flax seeds, chia seeds, walnuts. Cooling foods, especially coconut water, cucumbers, and cilantro. Reduction of caffeine, alcohol, and other stimulants. And last is grounding pranayama like alternate nostril breathing or anulom vilom. Various studies have shown that alternate nostril breathing significantly reduces the attack frequency and severity of migraine headaches. The post-migraine fatigue and disability is also improved with the simple pranayama practice. The third type is the Kapha headache, the heavy, dull, congested, and pressure-like sensation felt in the cheeks, the frontal area, behind the nose, and the eyes. This typically occurs in the morning after waking up or when the humidity is high. These happen when the mucus or the fluid swelling in the sinuses blocks the flow of prana. Typical triggers include cold and humid weather, heavy foods with dairy, oversleeping, seasonal allergies. Simple treatments for kapha headaches are steam inhalation with a few drops of eucalyptus oil, sipping on warm ginger tea throughout the day, and warming spices like ginger, black pepper, and cinnamon. Jal neti or the neti pot sinus cleanse is an excellent way to prevent sinus headaches, especially during the allergy season. The last type of headache that we will discuss is the cluster headache or the clockwork headache. This is excruciating unilateral pain that typically happens around the eye with tearing and nasal congestion on the same side. It occurs in clusters, same time daily or nightly. Ayurveda classifies this as a Vata Pitta spike, sudden onset Vata spike with severe burning pain of an aggravated Pitta. Clinical studies show that, like migraines, this is also linked to a sudden surge in nitric oxide levels that cause dilatation of blood vessels in the head, and they lead to production of reactive molecules which cause transient inflammation in the brain. Triggers include alcohol, smoking, high histamine foods, and excess air pollution. Many studies have linked severe air pollution to cluster headaches. The treatment options for cluster headaches are similar to migraines, with daily intake of 400 to 600 milligrams of magnesium glycinate at bedtime, omega-3 rich foods, CoQ10 taken in doses of 100 to 200 milligram daily for prevention. High flow oxygen is very effective in cluster headache and aborts attacks rapidly, but this is not easily available. Instead, a 20-minute practice of Anulom Vilom or alternate nostril breathing will help in improving the flow of prana in the head, and it has a calming influence on the brain. Some Ayurvedic options for cluster headaches are turmeric and ginger for their anti-inflammatory effect, Nasya therapy with Anutelam. You apply 2 to 3 drops of Anutelam inside each nostril at bedtime. Brahmi ghee or Brahmi oil head massage done 2 or 3 times in a week. You can massage a few drops of Brahmi ghee or oil on your forehead, temples, earlobes, and the top of your head at bedtime. This brings us to the end of today's video and a quick recap. Your headache type is not random, it is diagnostic. Vata headaches happen from stress, dryness, and depletion. These are throbbing headaches. Pitta headaches occur from heat, inflammation, and they cause burning or migraine type headaches. Kapha headaches happen from sinus congestion, heaviness that leads to sinus pressure headaches. Cluster headaches and migraines are Vata Pitta headaches due to neuroinflammation and autonomic dysfunction, and they cause intense painful attacks. When you know the type of dosha and the dosha imbalance, you will understand the cure as well. Let me know in the comments if you found this video helpful. Do let me know if there's any particular topic that you would like to hear about. And please don't forget to like and subscribe to the Healthy Buddha channel so we can keep producing more videos.